Hey everybody, Dr. Fedich here at Village Family Clinic in Hackettstown, New Jersey. We talked to you today a little bit about knee pain, class 4 laser, and all that kind of fun stuff. So we got a lot of patients in the clinic lately with knee pain. We've been helping a lot. I just want to explain a couple things to you quickly. So we got a little knee joint here. The knee's got top part and bottom part. And real simple, it kind of moves back and forth. The ACL and PCL connect it, and that's how things work. So the knee here, we're going to move up and down. When we walk, the way that humans walk, we basically put all the pressure on the inside of the knee. So this is the inside here, the outside. So when you look at a knee that's over 50, 60 years old, a lot of times people say bone on bone, and that'll be the inside of the knee that'll be bone on bone rubbing. The outside almost never rub, and it just starts wearing down some of that cartilage and causes some pain. So there's obviously knee replacement surgery shots in that, but we have some pretty neat treatment options here in the clinic. And one of the cool things we do here is class 4 deep tissue laser. So it's a big advancement, only available in the last couple of years. Class 3 lasers have been around a long time. They use laser to decrease pain, swelling, and help healing. Class 4 lasers generate heat. So the problem is if we leave this on one spot for too long, it can burn you or even cut you. And our new laser, one of the big advances why we do it now, it has this cool diffuser head on it. So instead of the laser just coming out of one little pinpoint, it gets diffused over a point over here, over a whole joint area. And that allows that beam not to just go on one point and possibly create heat and burn you. The other cool thing is that laser is one of the only treatments available that decreases pain, swelling, and gets rid of inflammation and promotes healing. So a lot of times we do laser for the swelling of the knee. Before laser, we would do a lot of ultrasound on this. Ultrasound's great at getting rid of swelling, but it doesn't do anything for the pain or increase healing. Also, while we have 4 ultrasound machines here, their max power is about 2 watts. Here on our program is on 12 watts just for the laser, and the laser goes all the way up to 30 watts. So it's just 10 times more powerful. So what the laser can do is we can pinpoint it on a joint, particularly the knee, on the inside of the joint where there's pain and swelling. It's going to decrease the swelling in there, stimulates part of the mitochondria of the cell to stimulate some healing, so it does regenerate some cartilage and heal. It also decreases pain. So it's the only modality available with pain, swelling, and healing all in one shot. It takes about 10 minutes per joint. The other really neat thing with this machine is there's a computer program. We have to know the wavelength, the joules, the duty cycle, the frequency of the laser. There's a very complex math in there. This machine does most of that for us. So we input the joint and what kind of condition, and pretty much the computer does the rest. We set it and forget it. There's no chance really we burn you or hurt you because of the diffuser head and the program where it's actually flashing over the joint so it doesn't overheat. It works really good. One of the other things we're doing for this knee pain is also using some unloader braces. So like I said, we have this knee will wear out this way where the inside's rubbing. And there's special unloader braces where they shift that knee back into position and it's able to move freely. So now when you're moving, that inside's kind of rubbing in there. If we unload that joint, we're able to move freely. So if we get that joint moving freely, the laser decreases pain and swelling. We can buy people a lot of pain-free days before they're talking about knee replacements. So if you or anybody who knows getting a real worn-out knee, thinking about getting knee replacements, you can sometimes buy yourself years doing this therapy. Class 4 deep tissue laser, some bracing, soft tissue work can really work wonders. So if you know anyone that needs our help, give us a call or text at 908-813-8200.